Ukiona St. Mary's Hospital imefungwa kwa sababu SHA haijalipa pesa na deni ya St. Mary's Hospital.
We need the money and then we will arrive. This is not a government hospital. It's a mission hospital that serves the poor people. So we cannot make politics out of the poor people. You can't blame me for suspending. If I can't pay you now, how do I keep you in the job? Even for the next month. And if anybody has to believe anybody, at least believe the church. We have no other ways where we spend the money except in those hospitals.
You have heard from him since inception December. SHA started in October. Since December to August this year, St. Mary's Hospital has received reimbursement from SHA totaling 98 million Kenya shillings.
SHA owes the hospital about 143 million. That is up to where NHIF sent to SHA. And we have always hoped that we shall be paid our debts from NHIF, which are not being paid. What has been processed so far by SHA up to now is 39 million. You know, now there is the claim that there are certain verifications that need to be done. We have had the problem with St. Mary's Mission Hospital, Mumias, whose functions had been on suspension on account of the strike of the workers or the staff, and therefore the function couldn't continue because of the salary arrears that they have incurred for 3 months. And that one, we believed that we got the payments that are due from SHA, we will have sorted them. So we've agreed, and I confirm that so far from December of 2024 to August of 2025, the SHA has disbursed a total of 98,671,567. And these have been dispersed across, spread over the months that we have had. We have, believe, a pending payment of 35 million claims, 5 million that we expected from SHA, and that's what we believe that will help us to be able to clear the arrears of the workers. And we are also received information because of the verifications that have to go on, that 10 million of the claims have still to be verified. So it means that we have to continue engaging with SHA, but I can confirm that we have had all the money. The genesis of the strike of the workers came because of the accruing arrears from NHIF, which is about 143 million. But now we are talking about what has been disbursed by SHA. And I can confirm that each month SHA has always disbursed its money, and the pending claims is what we have negotiated, and we have agreed that once other documentations are submitted, then we believe in the coming 1 week we may receive about 14 million, and that is able to help us to be able to engage the workers to return to work so that the people can be served. We want to thank the ministry for having made this effort to come, and I believe the idea of SHA, because of reaching out to all the patients, is a good idea that, well implemented, is going to benefit the Kenyans. As I have also noticed that they are paying promptly, though not all the claims that are paid, but they are able to help the patients. And listening to the CS and his team, you can tell that there is goodwill, and we believe together, when we are cooperating together, there will be greater effect in the work of the service of the people of God that is in matters of health. So I wish to reiterate that we are ready to collaborate and work towards the good of the people that we are called to serve.
On St. Mary's, I want to thank His Lordship the Bishop on coming and discussing. You have heard from him since inception December. She has started in October. Since December to August this year, St. Mary's Hospital has received reimbursement from SHA totaling 98 million Kenya shillings. And the man of the clock, the bishop, is behind me. And I'm a very true and believing Muslim. So we don't lie, me and him. Me and him, we might be two different faiths. The way I have a lot of respect for the religious leaders across our country. So we have paid 98. And we are paying him before next week, before 14th. In fact, we start paying him on Friday, his balance. And 14th, when the circle is being paid, money amounting to 14.3 million. The other balance, we have shown him how we are going to verify with him. So, St. Mary Hospital, from where we sit, has not been closed by SHA, has not been closed by the regulator, Kenya Medical Practitioners and Dentists Council. Their license is valid, has not been closed by the digital health agency that controls the system. So from where we sit, St. Mary Hospital has all the valid licenses from all our agencies. So those who are peddling in funerals and want to use St. Mary, I am telling them here from Kakamega, this weekend you better look for something else. St. Mary is not available for you. We have resolved it. And Bishop, when you open, I will come back. I will come back, and I will come back with the drugs. I will come back and we do a medical camp. We want to help the people of St. Mary's working with the church. Because our business is to make sure that we deliver accessible, affordable, quality health care to the people of Kenya within our borders. So those who are, whether they use the floor of the house, whether they use funerals, I don't know, Governor, whether they must look for something else. Because St. Mary's story is closed. And thank you, our Lordship, the Bishop. And we will make sure, and today the Bishop is very happy. We have taken him through our system. We have taken him through how SHA deals with the claims. And we have taken him how we should go forward on the pending bills of NHIF. And I want to make it very clear. The pending bill of NHIF are in two categories. And this pending bill of NHIF is why we had to close NHIF and start SHA. Because it was a den of corruption. It is where patients' money was being stolen, where people were building their wealth using patients' money. And it's immoral and unconstitutional. And we will not allow it going forward. So, anybody with a pending bill of NHIF from 1 shilling to 10 million, totaling 5.3 billion, accounting for 92% of the entire NHIF bill as a government on the direction of the president, we will pay in the next 2 months. We are only waiting for the National Treasury to introduce a supplementary budget, and we put the 5.3.